Hello everyone, welcome back. In today's video, we'll be discussing a very important LAQ of the upper lip. Make sure आप एग्जाम के लिए ये LAQ तो पक्का प्रिपेयर करके ही जाओ. Without preparing cubital fossa, don't leave for your exam. Cubital fossa बहुत ही frequently asked question है. उसी के साथ साथ easy topic है. अगर आपका popliteal fossa already हो गया होगा तो आपको पता होगा कि फोसा के अंदर कौन से हेडर्स में आपको आंसर्स लिखने हैं. Talking about cubital fossa, it is a triangular depression. For the fossa, you have to include the headers such as the definition. In the definition, you will just give an introduction regarding the cubital fossa, the boundaries of the cubital fossa, the roof, floor, and the contents, and the clinical. Okay. I have very well diagrams from the Gray's Anatomy book, which will help you to actually memorize the cubital fossa and to understand that where it is exactly located. Now, talking about the cubital fossa, if we see, it is homologous to the popliteal fossa of the lower lip. Okay. It is a triangular hollow depression, which you can see in the अपना ये elbow region, जो अपना elbow region है. Here you will find this fossa. So this region is called as the cubital fossa. Now, this is the medial side of the body, whereas this is the lateral side of the body. Now, talking about the medial side of the body, we have a muscle here, which is the pronator teres, whereas another muscle over here is called as the brachioradialis. So, from here, it's very clear that the medial border, the medial boundary is formed by the pronator teres muscle, whereas the lateral boundary is formed by the brachioradialis muscle. In between this muscles lies a triangular hollow, that is the cubital fossa. अब वापस once again, लेकिन जैसे मैंने popliteal fossa में भी बोला था that if you are mentioning any muscle, make sure that you will mention its border. Now, for the pronator teres, you can see that is the lateral border of pronator teres, and for the brachioradialis, it's the medial border of the brachioradialis. So, the cubital fossa lies between the lateral border of the pronator teres muscle and the medial border of the brachioradialis muscle. Okay. Now, the apex is the meeting point of both the muscles, whereas the base. Now, here अपना ये ह्यूमरस बोन है. ह्यूमरस के हो गए दो कॉन्डाइल्स. अब तक तो ह्यूमरस बोन देख ही लिया होगा. So, an line joining both the condyles of the humerus bone forms the base of the cubital fossa. This is about the boundaries. This is about the contents of the cubital fossa. So, once again showing you the boundaries. मैं आपको बार बार इसलिए दिखा रहा हूं ताकि आपके मन में अगर डायग्राम बैठ गया तो it will be very easy for you to memorize things या फिर understand the concept. अब आप क्या करिए, आपका हाथ ऐसा सीधा कीजिए and imagine on the medial side you are having, imagine क्या actually you have on the medial side the pronator teres muscle, which is the medial side of the arm. When your palm is facing upwards, the medial side corresponds to the little finger. That's your medial side. Okay. Now, talking about चलो ये diagram तो हो गया. Talking again about the boundaries, you can see medially you have the pronator teres, whereas laterally you have the brachioradialis का medial border, pronator teres का lateral border, and as you can see this is the humerus bone and it has two condyles. An imaginary line passing between the two condyles, for the middle and the lateral condyle, forms the base. Apex is the meeting point of both the muscles and the apex is directed downwards. You have to mention that the apex is directed downwards. Okay. Now, talking about the roof, क्योंकि floor हो गया तो उसके बाद तो roof ही आएगा. I don't think I have a diagram for roof again like the popliteal fossa. उधर भी same हुआ था. Okay. नहीं, this diagram can be included for the diagram of the roof. Since the roof of the popliteal fossa contains the skin, superficial fascia, deep fascia, and the bicipital का aponeurosis, that is the bicipital tendon. अब superficial fascia में हमारे पास है median cubital vein, which is the joins the अपना cephalic vein with the basilic vein. That is the median cubital vein. This is present in the superficial fascia. So once again, repeating the roof, it is formed by the skin, so superficial fascia, deep fascia, and the bicipital aponeurosis. Here you can see the superficial fascia has the median cubital vein, the lateral cutaneous nerve of forearm, and the medial cutaneous nerve of forearm. The middle cutaneous nerve of forearm is along the basilic vein since it's medial in nature, whereas lateral cutaneous nerve of forearm is lateral in nature. Okay, so this explains us about the roof and the boundaries of the cubital fossa. Now here also, this is a diagram for the roof, for the structures in the roof. If you can see that this is the biceps का tendon, then this is apna cephalic vein, this is the basilic vein, and this is the median cubital vein. So the median cubital vein lies in the superficial fascia, which is then the content of, which is in the cubital fossa. और उसके साथ साथ two nerves on the lateral side, lateral cutaneous nerve of forearm, on the medial side, medial cutaneous nerve of forearm. Now, talking about the floor of the cubital fossa, the floor you can see is formed by the two muscles, which is brachialis and the supinator muscle. Brachialis and the supinator muscle. जो हमारा अल्ना बोन है, उसके ऊपर अपनी brachialis muscle, whereas अपने अल्ला से लेकर radius तक we have this supinator muscle. So the brachialis and the supinator forms the floor of the cubital fossa. Now, as we are done with the boundaries, roof, floor, contents, moving on towards the contents. We are done with the boundaries, roof, and the floor. For the contents, and very easy mnemonic, that is the MBBR या फिर MBBS. MBBS तो नहीं, S इसलिए क्योंकि that's the superficial branch of radial nerve. Now, talking about the mnemonic MBBR या फिर MBBS, जो याद रखना है वो रखो. So M. Now, as always, contents जो है वो will describe. Then are we talking from the lateral to the medial side or medial to the lateral side? For the cubital fossa, the MBBS is medial to lateral side. MBBS is medial to lateral side. Okay. So the M stands for the median nerve. The M in the cubital mnemonic stands for the median nerve. B for the brachial artery. Again, the B is for the tendon of the biceps brachia, and R is for the radial nerve. So these are the contents of the cubital fossa. Now, अगर कुछ नहीं, इसके अलावा तो कुछ बचा नहीं है. अगर इसका क्लिनिकल आपको पूछेंगे, so clinical में basically in the cubital region, I've not included in the notes, I guess. Clinical. For the cubital fossa, you can see that's for the IV injection. That is, the IV is the intravenous injections. The median cubital vein, often preferred vein, is the median cubital vein. Median cubital vein is preferred. Vein is preferred. Whereas measurement of BP, that is the blood pressure, via the brachial artery in the elbow. Brachial artery. Okay. सो थियोरी वाले पार्ट में मैंने वही सब इंक्लूड किया जो मैंने आपको डायग्राम्स के थ्रू समझाया है. अ क्विक revision of the cubital fossa. Talking about the boundaries, if we see laterally, we have the medial border of the brachioradialis. Medially, we have the lateral border of the pronator teres. Base formed by the imaginary line joining both the epicondyles of the humerus, whereas the apex where the brachioradialis meets the pronator teres. Roof, skin, superficial fascia, deep fascia, and the bicipital aponeurosis. Floor formed by the brachialis and the supinator muscle. Contents MBBR. Clinical IV injection and the measurement of BP. सो दिस कंप्लीट्स अपना क्यूबाइटल फोसा. अगर एक LMR करेंगे हम डायग्राम से, जैसे हम हमेशा करते हैं. सो टॉकिंग अबाउट द बाउंड्रीज ऑफ द क्यूबाइटल फोसा, मीडियली बाय द लैटरल बॉर्डर ऑफ द प्रोनेटर टेरेस, laterally by the medial border of the brachioradialis, base formed by the imaginary line joining both the condyles of the humerus, roof formed by the skin, superficial fascia, dip fascia, and the bicipital aponeurosis. This superficial fascia contains the median cubital vein, accompanied by the lateral cutaneous nerve of forearm and the lateral cutaneous nerve of medial cutaneous nerve of forearm. The floor is formed by the brachialis and the supinator muscle, whereas the contents of the cubital fossa is the median nerve, brachial artery, tendon of biceps brachia, and the radial nerve. Clinical anatomy: intravenous injection. Often preferred nerve is the median cubital vein, whereas the blood pressure measurement via the brachial artery. So this completes our cubital fossa. If any doubt, you can directly DM me on Instagram. Yeah, you can put your doubts in the comment section. I will surely reply to it. The upcoming video will be regarding the forearm and the hand, because for the back of the arm, that's just, you have to remember for the posterior compartment, just remember the triceps brachii muscle, which I've already covered in the muscles wala chapter. Make sure that you read your text after this, and if you have any doubts, then you can ask me. Make sure that you memorize the boundaries and all the contents, everything of the cubital fossa via diagram, because that will help you to remember them for a long time. And make sure that you stretch your hand and you feel that here will be my pronator teres, here will be my brachioradialis. Okay, so that will help you to retain it for the longer time. Okay, thank you. All the best.